Okay, this is week 7, my SBAR report over Chase Neutra. The patient is Chase Neutra, date of birth 9/12/19XX. He's a 45-year-old male who is a full code with no known drug allergies. The patient came into the ER with complaints of fever and fatigue. The admitting diagnosis is that he has multiple myeloma and neutropenic fever. In 2019, he was diagnosed with the multiple myeloma. He then underwent chemotherapy and a stem cell transplant in 2019 and in 2020. In July of 2020, he was hospitalized for renal insufficiency, and he was diagnosed with renal insufficiency, thrombocytopenia, and pancytopenia secondary to chemotherapy. Socially, he is married. He has no kids. His wife is still alive, but his sister-in-law recently passed away. His wife is very on edge and anxious about the situation with his sister, and she's also in denial about the seriousness of his sickness. The patient, he described to me that his wife is just not really grasping the concept of how sick he is, and being that he's had multiple myeloma for the past 2 years, he constantly says that she's just blowing it off and not accepting it, or she's in the denial state of grief. The most recent vital signs I got on this patient were blood pressure 136/66, pulse of 137, respirations of 20 at a normal rate, temperature of 102.2 Fahrenheit, and his O2 was 97% on room air. He did have some abnormal labs. The abnormal labs, his white blood cells, hemoglobin, hematocrit, platelets, and neutrophils were all low. His lymphocytes were high. He is currently he's prescribed 5 medications. I only gave 4. I gave the dexamethasone, I gave the photonidine, the allopurinol, and the cefdinazine. I held the fentanyl because his last patch was given less than 72 hours prior. The current orders were to initiate an IV, which we did. We placed a 20-gauge IV in his right forearm. No signs of blown vein, and everything is intact with the IV. He is on hourly vital signs except for his temperature. He is on a regular diet, and he also is ordered Ensure supplements. He is on bed rest with bathroom privileges. He's on a strict INO. He has orders for oxygen up to 2 liters as needed to keep his oxygen saturation above 95%. He also has a CBC with differential ordered. Right now, we did consult hospice to meet with the family. Both the wife and the husband requested that. The husband is more on the page of he told me that he wants to sign a DNR, and that he doesn't want any kind of life-saving measures because it is traumatic for not only him as the patient but his wife to see. So going forward, I would like to ask the doctor about the neutropenic precautions, because he is at the point where he does want hospice care, and he's not accepting any medical advancements. So I would ask about the neutropenic precautions in the diet, because I think that could be switched to regular. I would also ask about getting some kind of pain medicine. He did say he was in 8 out of 10 pain upon assessment. The only thing that was abnormal was the sounds in his lungs bilaterally were diminished. Once again, like I said, my recommendations going forward are to consult hospice. Ask the Dr. Smith about the neutropenic precautions and the diet, and then provide comfort care and then support to the wife. That is it.